Good morning, everyone, and thank you for joining us for this Nurture Benefits webinar. Going to give everybody just a minute to get in. And I want to be mindful of everyone's time. So we're going to start here just shortly. All right. I want to kick this off this morning. My name is Michelle Beebe, and I'm the Chief Revenue Officer with the Small Business Association of Michigan, and I'm also a member of the board for Nurture Benefits. I also want to introduce you to two faces and names that you're going to hear often, Brianna Schumann and Kevin Concanon, that are here. They are the members of your Nurture Benefits team. Kevin is the director for member care, and Brianna is a member care coordinator that's a member of this team. So wanted to introduce the two of them because as we start to get more and more into the thick of things, you'll learn that I am not the expert and that the two of them are your experts, and you'll want to leverage them as much as possible. So there's going to be a lot of information. I know some of you have already have sent in messages or called us, and I'm going to do my very best to get through the important things this morning that I'm sure are nagging at all of you, but I'm also can't promise that I'll have the answers to everything. So the plan this morning from a housekeeping perspective is that we will keep the chat open throughout the communication, and Kevin and Brianna are going to do their best while I'm going through the presentation to answer your questions. Please know that a lot of this is still really new, and we may or may not have the answer to your question. And so if we don't know, our policy is we're not going to make it up. We're going to tell you we don't know, and we're going to get the answer to you following the presentation. We also will be sharing the recording of this to all of you that have been registered, and we will also be sharing a copy of the slide deck, so you have an opportunity to have that as well. So please answer questions as we go in the presentation, and I will do my best to cover what I hope are all of your anticipated questions. Sound good? All right, gonna share my screen here, and we're going to get on our way. And just so you know, I'm not able to see your questions, so that's why you'll need the expertise of the team. So as I said, I'm Michelle Beebe, and you'll probably have seen my name on a few things that I've sent out some emails to some of you to keep you up to date. Please note that if you aren't on our distribution list, please add yourself at the Nurture Benefits, and Brianna is going to add our websites and some of our things here. Are you not able to see the PowerPoint? Sorry. Technical difficulties already. Are we able to see it now? Okay, sorry about that. So Brianna will add in the chat some of our website. If you haven't already gone to the website, that's going to be where we constantly are updating information. There's also a spot up in the upper right hand corner for you to register to be on the news list to get hot off the presses information. So what is Nurture Benefits, and why did we create it, and what are we doing here? So Nurture Benefits is what I'm going to affectionately call moving forward in this conversation a MIWA. And a MIWA is a Michigan Multiple Employer Welfare Arrangement. And what that fancy word is there is some legal stuff that we had to do with the state of Michigan and the Department of Insurance to create what we call an industry pool. It provides a way for all employers, regardless of size, and um, but they have to have a like industry to pull together to offer employee benefits. So for us, this was a very attractive way because we know all of you are different shapes, sizes, and have different needs to put all of you at the same advantage of a large employer. So if you're a large employer, you start to be able to offer benefits that are outside the market requirements for national health care. It allows for you to get outside of that age banding requirements, and allows for us to build long-term this plan in one big pool. So the experience and performance of this pool is really what the rates are going to be based off of, and not the giant pool of all employers together, but specifically childcare providers. And the nurture benefits was created because, as I think most of you know, we're a recipient of a federal grant. It's a 2-year pilot. We're pretty much almost through that first year. And that's designed to help Michigan licensed and license exempt childcare providers access to affordable health benefits, and not just health benefits, but dental, vision, life, disability, and 401(k) benefits. So Nurture Benefits was created. It's an LLC. It's a subsidiary of the Small Business Association of Michigan, and it's governed by a board of childcare providers and a member of SBAM. Me, I'm a member that sits on the board. So, and I'm really there as an advisor to talk about all the boring things related to compliance, laws, and insurance to make sure that we do everything on the up and up. So why does this matter? Why did we decide to do this pilot, and what are we trying to accomplish? So in some of our surveys and information that we've been gathering, not only from the state and our friends at MyLeap, but also through our own surveying, it appears that only about 35% of childcare employees are currently receiving health insurance through their employer. And one of the biggest things that I know I'm speaking to the choir is your biggest challenges are financial burdens, slim profit margins, lack of affordability for employee benefits, workforce shortages, wage disparities, administrative and regulatory complexes, and competitive talent. And that the list um, is going on and on. And I'm being told you guys still can't see my presentation. Is that true?
I can see it, Michelle, but you're still on the first slide.
Okay, I'm gonna stop. Well, I'm sorry, you guys are, this is the, I practiced and everything, and you wouldn't have known that. I apologize. Are we able to see it now? Okay. So one of the reasons why we wanted to do this is that we wanted to tackle those challenges within your industry, but also to create an employer-employee relationship that builds loyalty. Usually when an employee is getting health benefits and benefits from that employer, they think secondly about maybe not quitting, going to another employer, all of those kinds of things. And the turnover rate in your industry is very high. And not only will this help attract employees, but hopefully it is our desire to keep employees. So who we are, first of all, did my slides advance? Okay, good. All right, the Small Business Association of Michigan. Who am I? Why am I here and why am I doing this for you? So we are a 50-year-old statewide association, and we've kept it pretty simple. Our mission in general is the success of Michigan small business owners. And and we have kind of 3 arms within our organization. We focus on advocacy and policy, products and services for our members, and then engagement and education opportunities so that we have but generally we serve small business as a whole, and our policy, all of those things are very related. based on what is good for general small business. Now, we have in the past, because child access to childcare and having a stable childcare um, system, it affects all of us, and it certainly affects employees and small business owners to make sure that their employees have access to childcare and that their children are getting taken care of. And so this has been something that SBAM has long been involved in at the policy level and in partnering with MyLeap, and we are part of a couple of task force associated with that. And then, crazily enough, SPAM, over the last 30 years has had a very interesting relationship with employee benefits. We actually have created our own subsidiary, and it's an agency called the Small Business Insurance Services. And agency has been supporting and taking care of employee benefits for over 30 years. So we have a standing relationship and expertise in this space. We have, and so that's kind of how I think the state of Michigan found us, that they knew that had played in these spaces, knew that we had experiencing on being creative and thinking outside the box when it comes to offering employee benefits. So this is kind of how we started this relationship. My Leap, gosh, it's been a while now since reached out to myself and my boss, Brian Kelly, and started asking some questions about, hey, is there a way that if we were applying for this grant, that we could potentially put together a competitive employee benefit package for childcare providers? And we were like, absolutely. I think there's some different ways that we could go about this. I did a bunch of research, put together a proposal, and then MyLeap included that proposal in their grant application, and they were awarded it. So with that, SBAM was awarded a portion of the grant to help get this off the ground and do the compliance, the back behind the scenes piece, and then also a portion of it was set aside for subsidy, which we'll talk more about. And so we also have some platforms. You'll see there's some different things that we'll be providing you as we go through this conversation. We have a customer service platform that I'm going to encourage you to get enrolled in as soon as possible. And then we also have what we'll have as an employee benefit platform as well, that when and if you choose to enroll, that will help you set and choose plan design for your employees and allow your employees to roll. But at the end of the game, the whole point of this is to make affordable healthcare to your industry and for your employees, and that's an access for people. So that's the goal. As I mentioned, there is a governance structure. Obviously, while SBAM certainly is an expert for small business, we're not by any means an expert in the childcare industry. And we wanted to make sure that when we set up nurture benefits, that it was governed by at least 6 childcare providers within the state of Michigan. So you have a board of smart women that are leading the charge. And then again, myself, I'm on the board, and really I'm there as a liaison, taking care of business, helping them get what they need to help make them make some informed decisions. Some of the things that the board had to decide was we put out a request for proposal to national and state carriers for this to just make sure that we were shopping the best plans and the best rates. And one of the crucial things was, well, obviously affordability, but secondly, we wanted to make sure that we had a statewide offering and making sure that any of those carriers that we chose were going to be able to offer benefits in all counties within the state of Michigan. And so we're a big state, and our friends up in the Upper Peninsula have different challenges, and we wanted to make sure that we were taking care of them as well, because they have limited less access to open networks and those things. So all of those things came into play. And so with that, there was several RFPs that we received, and really Blue Cross and Blue Shield and Blue Care Network of Michigan was the one that kind of checked all of the boxes as far as access to care, being able to allow us to have flexibility in our benefits, allowing for us to really make a statement in this space. And also Blue Cross understood the mission and really leaned into that. And so that's partly why we went in that direction for the health, dental, and vision piece of this. And then you might ask, why did we decide to do a MIWA? And a MIWA really was the best approach for us to be able to allow our in-home providers access to the same benefits as those that might be a center where they have more employees and they have more benefit offerings. We wanted to make sure that we leveled the playing field in the state of Michigan, so everybody was treated likely and they had access to the same benefits. So what's unique in this is that we are able to go down to a sole entrepreneur and they are eligible for group insurance. And again, we wanted to be able to build longevity and have this pool be owned by childcare providers. That's the whole point of this, and not being governed by childcare providers. I also, as we start to go in this, and again, we're going to send this presentation, so you don't have to remember everything, and the recording is going to be there. But there's a couple of important dates that I want to make sure that you have on file. So one of the most important thing is that we're going to be open for business, so to speak, to take applications starting November 15th for January 1 effective dates. So I want to say we kind of been using, and this is an insurance term, but we've been using open enrollment will begin January 1. And that implies that you aren't able to enroll after January 1. And you can. So if maybe your business is already offering insurance and your renewal is in June, for instance, then you can move and make that change in June. But what most likely is going to, and we'll talk a little bit more about how the subsidy is going to work, is to be eligible for that subsidy. It's going to be that January 1 effective date, but you can move at any time throughout the year. And we want as many people, whether you're subsidy eligible or not, to be part of the program, because the more of you that are in the pool, the more chance we have to negotiate our own rates and for this to have longevity. We'll talk more about that in a little bit too. So benefit eligibility, and again, because this is an employer benefit, right? So think this is something that I'm offering to my employees or for myself as an employer benefit. So you need to be headquartered in the state of Michigan. You can have locations outside of the state that are completely eligible for benefits, but you need to be a Michigan-based business. Actively licensed and license exempt in the state of Michigan. Your employees will be that are eligible for benefits are they work 30 plus hours a week, and they will be eligible for benefits after 60 days of employment. So new hires will be eligible after they've been on the payroll for 60 days. Who is eligible? Center-based, family home, and group home. Everybody, and as I mentioned, it goes down to one. Another important thing, I just think, because this is sometimes a question that we get, and it could just be because I live in the insurance world too, but a lot of times we ask about dependents, and the program does allow for children ages 19 to 26 to stay on their parents' benefits as a dependent, and then they would lose those benefits on the end of the calendar year of their 26th birthday. And then domestic partners are also eligible for these benefits. All right, I'm sure this is the why you all showed up, is the questions about subsidy eligible and how is this going to work. So the state of Michigan has received with the grant money, they are providing $1.8 million in grant subsidy dollars. And as you all know, I wish I had $1 billion and I could offer a subsidy to all of you, but we're starting out with $1.8 million, which is a lot. It sounds like a lot. It is a lot. And we wanted to be able to make sure that, and so this is an area that the board and myself spent a lot of time on, not only the plan design and what we're offering, but how we're going to offer the subsidy, and partnering with the state of Michigan, and the state of Michigan weighing in on what the desired outcomes are and making sure that we get benefits and are making a difference in those that don't have benefits today. So it's going to be a weighted lottery system. Providers receive points based on an attestation responses, and we're going to talk a little bit more about that. Questions are weighted to enter the lottery. So depending on how you answer the questions, you may have more than one entry to be in the lottery. So um, again, trying to be fair and equitable as much as we possibly can. And then the other piece that's weighted is county level data and making sure that not only are we providing access, but we're providing equal access throughout the state of Michigan. And so again, it's a $1.8 million grant subsidy. It's an employer health program. So it's something that you as an employer have to decide if you want to offer it to your employees. And then with that $1.8 million, it 484 eligible employees through their employers will be eligible for the subsidy. And the subsidy is going to be 50% of the approved base premium amount. And the 50% is of the single person rate. So not like if they're a two-person or a family, you're still going to only get 50% of the single rate. And it's 50% of the single health, dental, and vision. So we felt it was really important from your feedback that dental and vision be part of the subsidy because so many of you have indicated that you're not offering dental and vision today. And so we really wanted to make sure that that was part of that because whether you know this or not, but people taking good care of their vision and their teeth actually create an overall healthier person. And those are really important things to package together. So the subsidy application, so this is what's going to need to be filled out on November 15th. It's general information, owner name and information. If you're not the owner that's completing it, which you have to be an authorized employee to be making these decisions. So the title and of the employee and their information, the business name, federal ID, license number, the county, and the address where the business resides and number of employees. So how many are working 30 plus hours and how many are working less than 30? And then some questions about the health status. Do you currently offer coverage today? Do you offer coverage, but you're not able to contribute? Do you offer and contribute to health coverage? And then if you do offer coverage, what's the name of your insurance carrier that you're offering group? And again, this is group coverage, not if people have Medicaid, they're on the marketplace, any of these things. This is legitimate market or group insurance. Well, so that would be like a Priority Health, Physicians Health Plans, Aetna, United Healthcare, HAP, those kinds of things. That's group insurance, and it could be Blue Cross already. So, and then information on whether all employees are being offered coverage. So you may be offering coverage to maybe just your lead teachers, or you're segmenting them out in some way. We want to know that information as well. And a lot of that's just so we have historical audit data that when we're reporting back to the feds, that we have all of this information so that they can see who we're offering coverage to, and there's an audit of information there. And then this will be have an electronic attestation signature and date. And then we'll also be asking for an employee census. So, and we'll have a template for that so that we know how many of your employees currently are insured, all of that information, their information, so that we can help you should you decide to move forward and whether you're subsidy eligible or not. And you can make that decision and help you make a plan choice and help you get access to our employee benefit portal. That was a lot of information, but again, you're going to get all of this behind the scenes. And here's some information. So again, we partner with Blue Cross and Blue Shield and Blue Care Network. Happens to be that all of the plans that we are using are through the Blue Care Network network. And the base package is, so we have a base, mid, and high plan. So the base plan, again, is where we're paying 50% of the single. It is an HSA high deductible plan. One of the things that I want to, and I know the screen is really little, so I also want to point out that on our website and the service portal is a flyer for you to be able to download, and all of this information is there. All of this stuff that I'm talking about today, as well as FAQs, will be available on our website. And most of it's on the service portal. So that's important to go to that direction. So there's an HSA, there's a mid plan, and then there's a high premium plan that you can pay the difference. Like if you're paying and contributing today, you can pay if you want to just do the subsidy, or you can add an employer contribution to this as well. So there's some flexibility as an employer on how you would want to offer benefits. One of the things also that we really heard from you is that behavioral health and mental health benefits was really important, and all of these programs offer those benefits, and at different levels, but you do have access to the full network of providers in that space. So I just wanted to point that out because that's very important. All of them have prescription benefits. They are at different levels. All of them have 100% of preventative care. So wanted to touch base on that. Dental and vision. So there's also dental and vision benefits. It's Blue Dental, so there is a Blue Dental PPO network that you can use for access to providers. It's 100% on class one benefits. Class one benefits are what's considered exams and preventative work. Class two is fillings and x-rays and diagnostic, and it's $50 per member on a deductible, and then 150 family deductible on class two, and then it's a 50% coinsurance after deductible has met on those class two benefits. And then class three deductible, three is also the same deductible, same coinsurance. And class three, in case you're wondering what that is, that's like root canals, crowns, bridges, those kinds of things, the more expensive ones, unfortunately. So that's the dental program. And then VSP Vision is the vision that's being offered. And you do need to use a VSP network. This is the largest network of providers in the country is VSP. And so I think you'd be hard pressed to find someone that isn't taking VSP. And it allows for you to have, it's a 12-month benefit. So it renews as you use your benefits every 12 months. A $10 eye exam, $25 copay on prescriptions and frames, and then a 25 copay on medically necessary contact lenses. So that is the vision benefits, and there's more details on each of these plans. There's what we call a benefit at a glance that is on the service portal that goes through all the details of all of these benefits in greater detail. What I've got here is just a high level. Now, how much is all this going to cost, right? That's the $1 million question. So the base plan and these rates do not include the subsidy. So what I'm quoting here would be 50. You would, if you are subsidy eligible and you qualify, it'll be at 50%. So the single rate is $582.66. Doesn't matter where you're located, what your census is, it's the same rate for everybody. And 582.66 for the base plan. For the mid plan for a single is 741.96, and for a high premium plan it's 863.01. Those are the base plans. Or that's the single rate for all of the different plans. And then for dental and vision, it's 32.41, and the VSP vision is $5.01. So again, the single rate for the base plan is 582.66, 32.41 for dental, and 501 for vision. And if you're eligible for subsidy, that will all be cut in half for your employees. Life and disability. This is one space I'm a little bit behind on. I can tell you that we are going to have a life and disability program. It is going to be tailored specifically for nurture benefits. It is going to be partnered with One America Financial. I'm hoping by the end of the week that we will have these details available for you and that they will be available on the portal. So I'm sorry, it's a bummer. I don't have these available at this time. The other piece of that you have as an eligible member, well, actually, you don't have to be a member. And I should have said that in the beginning too. Just because we're an association, you might think, well, do I have to be a member of SBAM or do I have to be a member of Nurture Benefits to participate? There's no member requirements. You do not need to be a member of any of our organizations to be access this. This is a state MIWA program that we're offering, and there's no additional costs for you to be eligible for these benefits. one of the other programs that you are able to look at for your employees is a pooled 401k program. And this is a PEP is what you'll hear it called often. It's a pooled employer plan. It's the same kind of concept as the MIWA, but it's in the 401k space, that everybody's one big group in there together. So you get the benefits of the bigger the pool, the better the performance, all of these different things in the risk. It also we have a PPP that manages the administration for you and the oversight, works with your employees on any of their questions that they have about their investments. And then they also do one combined 5,500. So you don't have to file the 5,500 or any of that over or the audit piece that is usually a big expense to the employer. You also don't have mandatory match requirements, and you can participate that way. And then audited plans and benefits, some depending on your size you'll be big enough that you would have to have a separate 5,500, but that those plans and benefits are done at a reduced cost because you're part of the program. So again, it's not anything we can offer subsidy to because it is a 401k program, but it's an incredible value add that you could offer to your employees. As we start to get through heading towards November 15th, one of the things that I can highly suggest is that you go in and create your online account at this link here. And I hope Brianna's got this in the chat. I haven't been watching the chat. So that it's in the chat, create your own account so you can communicate with the team. November 15th or later, you can complete your employer attestation form and submit it to the team. You can, a nurture care staff member, a member, Brianna and many others will be here to support you, to send you access with the benefit portal, but also to ask you more questions about the benefits, how they would work, anything that you have a support team that's going to be here specifically for nurture benefits that's supporting you. You will have additional enrollment paperwork that's required, like you do when you enroll with any health plan. Employee elections, employees will have to go through the online benefit portal to select their benefits. And then you also have, as I mentioned before, some flexibility in how you want to offer employer contribution. And then one of the things that's kind of unique with this is because you are going to be considered a large employer in this program. So all of you, regardless of how many employees that you have, your employees will be COBRA eligible. So if they leave for any reason and they meet the COBRA requirements, they would be eligible for benefits. Again, if they were subsidy eligible at the time of enrollment, subsidy does not apply once they become COBRA eligible. They would be paying COBRA at that full rate, and the COBRA is at the cost of the employee for them to elect those benefits. Our team will take care of all of that, but because this is a MIWA, all of you have to comply with COBRA rules and regulations because of ERISA. There's some laws here that we just have to take care of. And so there will be some COBRA paperwork that will be necessary for us to have completed to make sure that we keep you compliant through this process. And then who's delivering this? Who's supporting this? What do you have? I've mentioned it several times, but we have on-staff licensed insurance agents to help you with any of your questions. We're going to help you with compliance, summary plan descriptions, your COBRA compliance. Here's the phone number if you need to call anybody. It's live and active. We have a portal to make sure that we're here 24/7 to help you can, because I know some of you are doing this, in the evenings, right? Well, we may not be here, but you can submit your questions and your questions through the portal at any time, and we'll take care of you. We have some very high customer service standards that you will receive within the first 24 hours, a response and who's taking care of your question, your inquiry, and most of the time we like to have all of our answers back to you within 4 business hours when feasible. The portal will allow you for ways to submit your documentation, allows for you to talk about plan levels. And also one of the important things is we're not letting you go. Once you get enrolled, you're going to have questions, right? You're going to have questions about your bill, how to, questions about managing your contributions. What if you have an employee that gets married or one that gets divorced or have a new hire and you need help through that process? All of those things, we have a team that's going to help you all through the process of taking care of your benefits. And then most importantly, through this process is that we don't want to have this, it is not the goal for this to be a 1 year program. It is for this to become sustainable. And so not only are we, yes, the grant is $1.8 million today, but we're all going to be working MyLeap, myself included, on working with key stakeholders and people in your communities that are willing to donate towards the subsidy and be able to make a difference in this space. And so that we can continue to offer the subsidy to more and more child care providers. And we and then work with state legislatures here in Michigan to make that build this so this is long term and sustainable. And so in order for us to do that, we have to work together to make sure one, our voices are heard, but also if you have maybe someone that you work with in your community that might, whether it's philanthropic or a key stakeholder that you think would be interested in helping build this program for sustainability, please let myself know or your partners at MyLeap know on how we can partner with them and talk about what the program is and the value of this, because it is so important for us to control costs. One, to have as many of you enroll as possible, and two, that we're spreading the risk throughout the state of Michigan, and three, that we're building plans and managing rates based on claims experience. And the only way to do that is to build a sustainable model. And that's very important to the board and I, and it's certainly very important to the state of Michigan. That was a lot of stuff. And I know it's a lot to digest. Again, we're going to send over some information as we go, as a wrap up. I'm going to shut my screen down for a minute and allow for you guys to add to the chat if you feel like there's things that need to be added. Um, anything that you need there.
Michelle, I have a couple of questions that I think we can pick off right now. One of them, how would this work for an out-of-state college student as a dependent?
The network does allow for you to be able to pick a provider out of state. Yes.
And then do lower income counties get more points?
No.
And will they apply for this every year? The subsidy?
That I don't know. We'll have to ask the state of Michigan.
And then can you just touch on real briefly the difference between focus and non-focus?
Focus is a narrower network. It allows for the rates to be reduced because of providers, but we also know that we wanted PCP that wasn't going to work for everybody throughout the state, and so we wanted to be able to so if you aren't using PCP focus, the rates are slightly higher, but it opens up your network so you can have doctors in all areas.
Great, thank you.
Sure. I see also a question in here. Are we invoiced by the company or paid directly? You'll be invoiced by Nurture Benefits and it will be minus the subsidy amount. So you'll be billed by us technically, and your premium dollar will be adjusted accordingly if you're subsidy eligible. I think you also, some of these I answered in the presentation, but I just wanted to make sure I'm reading through these. It is for the entire state, and I think Chris here, if just out of curiosity, if we don't get chosen, are we allowed to still purchase? Absolutely. Anybody can enroll, subsidy or not. And let me see, was there anything in here that I don't
Those
think?
are monthly premiums, by the way.
Yes. Yep. Um, yeah, guys, I wish it was cheaper. I'm sorry. Health insurance is no joke these days. I'm sorry. Um, public school or preschool programs are licensed and licensed except child in the state of Michigan. If they are, then you are eligible. So any questions that are urgent that I haven't answered in the chat or verbally? There's a question of like, why is the double over twice the single rate? It is a calculation that comes from the carrier. That's not something that I get to choose on, but it's usually because of claims experience, and that's being decided on about from actuaries at Blue Cross. So sorry. Um, how long after filling out the application will we know if we qualify for the subsidy? That's a great question. And um, I'm hoping within a week of you applying would be the answer. Can you do dental and vision without a base plan? You sure can. You can just buy dental and vision. Can you see counties for eligible focus rates? On our website is on the service portal is two really nice brochures about the PCP focus and what counties are available and how the program works. So without me boring you with all those details here, I think it would be great for you to pull that information down and see what works best for you and your employees. Again, rates and all of that information will be available on the site. You guys can pull that down and use that for any of your questions.
If the employee leaves, no, they are not still eligible on their own. That's where Cobra would come into play. If they
Correct.
choose to buy back onto the plan, they would be responsible for the premium.
Are these rates the same for any number of employees? Yes. BCN is not directly billing anyone. The bill will come from um, Nurture Benefits. And if you're subsidy eligible, it will have this minus the subsidy. It's up to Nurture Benefits to pay the carrier, not you as a provider. And again, because this is group benefits, it needs to be offered to your employees through the employer, not independently for your employees. Yes, Nurture Benefits is accepting donations. We're actually, SBAM has a foundation that has a dedicated donor donation space for Nurture Benefits. And please let me know if you need more information there. But no, the employees are not responsible for paying their own monthly payment. It will come to you as the employer. Again, this is employee or benefits. So the employer is going to get one bill for all of their employees, and that will be listed out for the parts of what that is. So you can either do payroll deduction for your employees, contribute to it, or just take the subsidy. I'm sorry. I know some of you are. I'm doing my best, guys. I did my best to get the lowest rates possible. This comes directly from the carrier, and this really was the best option. We are not making any money off of the plan. No. We are getting administrative fees paid for us outside of that. But no, we're not making any money off of this. Do you know if we're receiving a discounted rate because of this program for those of us that don't qualify? I'm asking because how much I pay currently with the same insurance that I have. I'm not sure I understand that question. We're receiving a discounted rate because of this program. So I want to be clear on how the rates are calculated, and I'm going to do my best to not bore you with insurance space. But we don't have an existing enrollment, right? So I can't take a census to a carrier and say, this is who I'm going to get to enroll. Can you base these rates? And so what any carrier had to do was take an actuarial best guess on how many people will have enrolled and what those rates will be. So what the biggest difference is when um, as we go to next year, that's when the rates are going to be based on us, not their best guess. So when I say the benefits is the more people in the pool, the more solvent that we make this, the better the rates will be when we go into renewal in 27. But unfortunately, right now, the carrier's taking a best guess risk on and their actuarial team puts those rates together. So that's how the pricing is made. So today, when you get a price, it's with your own census and it's based on that. But I am getting the rates directly from the actuary at BCN. So yep, you guys may have a younger population. You may be able to pay less. I understand that. Everybody's different, but this was built to take care of all sizes of business. So yes, that is the case. What happens after the 8 point grants? So the 8.8 million is going to be available to 484 employees. After that quota, 484 employees has been met, we are out of funds unless we raise additional funds to the plan. And yes, you are still eligible to contribute even if they get the subsidy. The carrier's not going to reevaluate rates this first year. They have to cover claims experience. It's a little risky for them to take this on the first year because they don't know what the enrollment is. So I'm happy to any of you that are insurance nerds and wants to talk about the details of how rates are calculated and an off thing. I'm really happy to do that. But I promise I advocated very hard to make sure that we made this as fair as possible. All right, I think we have, no, the rates cannot go up. They're locked in for 12 months. And retirement plans are available January 1 as well, and so will the life insurance. Thank you, everybody. I'm so glad so many of you were able to attend. And I'm sure you'll hear more from me in the group as we go through this. And you had some really smart questions, so I really appreciate it. Thank you so much. And have a good day. And the recording's coming, the pieces and the materials are coming, and again, we're available should you have any questions. Thanks again. Take care, everybody. Bye.